You're watching this video because you don't know if you can trust your dentist. Well, I'm here to help you. Hey, I'm Dr. Avi, and I'm a retired dentist and entrepreneur. And on this channel, I like to keep it real with you and help teach my colleagues and patients about clear aligners and the reality of dentistry. Look, navigating trips to the dentist can be tricky for anyone. You're either seeing a new one who's offering you a bunch of treatment that you never thought you needed, or you're seeing the same dentist that you've been seeing for a long time, and they mention a new procedure that can help you. A procedure that falls into this category is the fastest growing procedure in dentistry, which is known as clear aligners. And it's actually a really good procedure if you qualify for it. However, not all dentists are trained in dental school to do this procedure. So it's on the individual dentist to then seek out education after they graduate dental school to get good and learn how to do the procedure. The ones who do are well equipped to treat a range of cases, most of them being simple to moderate cases, and they can easily refer the rest out to the orthodontist. So if you want to build trust with your dentist and gauge whether or not they know what they're actually doing, ask them these 3 questions. How long is this going to take? Have you dealt with cases like mine before? And what do we do if the teeth don't end up in a position that we're hoping for? After you ask these questions, you really need to pay attention to how they respond to you. Are they hesitant? Are they rambling? Are they looking away when they're talking to you? These are all signs of a human lacking confidence. Okay, let's break down each of those questions now. If a dentist can't tell you the estimated treatment time for aligners, and they tell you to come back for a consult because they want to submit the treatment plan in the software and see how many trays it's going to take, this may be a sign that they're actually not sure what they're doing. You see, if a dentist is confident in the cases that they can treat, most of them can tell you point blank how long it's going to take. And if they can't, they may just choose to refer you because it's out of their scope. That additional consult appointment is actually a waste of time for everybody. And it's usually a sign of a newbie dentist that's doing aligners. Because if the dentist has treated cases like yours, they will have an estimate in mind. What I learned over time is that most of the cases that are simple and moderate usually take about 6 to 8 months to treat. Now, something to remember about treatment times, all teeth move differently. So don't hold your dentist to an exact date amount. Remember, we are moving teeth inside of human beings' jaws. There's going to be a little discrepancy sometimes. And I've personally treated cases that seemed like they were going to be super easy, but they ended up being very difficult. Combine that with the fact that the patient wasn't necessarily wearing the trays as much as they should have, and the case ended up taking a really, really long time. Before we move forward in the video, please comment below and share your thoughts. Have you gotten aligners before? Are you thinking about getting it done? Have you asked these questions to your dentist? Let me know in the comments. The best question to ask your dentist to know if they're a fit for you is, have you dealt with cases like mine before? When you ask this question to the dentist, it allows them to have an opportunity to relate your cases to previous ones that they may have treated. Now, your case may be entirely unique. However, if that's the case, the dentist will most likely share this with you. Then, if they go ahead and tell you the plan that you need and how they want to treat it, you should have confidence in them. Because even if they haven't treated a case that's just like yours, if they have a plan to treat it, usually it's a sign that they actually know what they're doing. And I've been in this situation before where a patient asked me if I could treat their case, and honestly, I have never treated a case like that, nor did I know how to treat it. And so instead of bullshitting them and making up a story that like I knew what I was doing, I was honest. I told them, I've never done a case like this, and I think it's going to be best if I refer you to a specialist so that way you can get the treatment that you need. The patient was very appreciative of me being honest and telling them this. I slept great at night knowing that this patient was going to be taken care of, and my orthodontist was very happy to be able to help this patient out. This is how everyone can win. Now, if you're a dentist and you want to learn how to start offering aligners and start doing the simple, moderate cases, I created a free masterclass where I teach you how to start. The link for it's in the description below. So what do you do if your teeth don't end up in the position that you want them to after you wore your trays as instructed? There are a few options here. Most of the time you're going to get additional trays, which is called refinement. This is pretty standard, and it's a way to really dial in the final details of the tooth movement at the end of treatment. Sometimes this can be a few rounds. If certain teeth still aren't moving, then a conversation usually happens between you and the dentist. You're going to talk about whether the tooth itself is unmovable for different reasons, or if you should see an orthodontist who can use different treatment measures to get the job done for you. All of this should be articulated to you by your treating professional if you pose the question. I had a patient where this happened. He was an older gentleman and he had some crowding on the lower lower teeth. The case seemed to be pretty straightforward because it was a basic crowding case, or so I thought. And we had to do 2 rounds of refinement at the end because his lower canine was not moving the way we wanted it to. Everything else moved, but the canine was getting stuck. I tried different techniques like IPR and rotational movements and different attachments. It still wasn't budging. I was distraught and I felt so bad because I thought I was doing something wrong. I felt like a fraud. This was probably the 10th case that I've ever done, and I couldn't get a tooth to move. I felt like I had failed. And so I asked my mentor, what do I do in this situation? And they recommended that I send the patient out for further imaging because there was a chance that something was going on underneath the gums and bone that I wasn't aware of. So he got the imaging, came back, and it turns out that that tooth was ankylosed, which means it was fused to the bone. So this tooth wasn't going to move regardless of who was treating it and trying to move it. So unfortunately, we could not get this tooth lined up into the ideal position, but we did improve the rest of the positioning of the teeth. And this is just what happens sometimes when you're working with human bodies. There are variables outside of your control. And just because you can't get one tooth to move doesn't mean that you're a fraud. As long as you tried and you were resourceful, that's the best you can do. Now, if you found this video helpful, you are definitely going to want to check out this video where I dive into how clear aligners actually work. I go through step by step every phase of the process, and I think you're going to love it. I'll see you in there.